Today is National Nurses Day, and we are joined by two from Interim HealthCare to celebrate Nurses Week and really the impact that they make every day in our community, especially in the home. So I want to say hello to Miss Brianna and Christin. Good to see you. How long have y'all been nurses?
19 years.
Oh,
10 years.
10 years and 19 years. What made you choose nursing in the first place?
This may sound a little cheesy, but I've always wanted to be a nurse since I was a little girl.
I love it. What? You just like, you just have that, like, want to take care of people, want to fix it?
I want to take care of people. I love people. I love seeing people get better.
Yes. But you also see people like at their worst sometimes too.
Yes.
You got to have that skin, you know what I mean, that in you to.
You do. You do.
Yes.
But it's so fulfilling.
I love it. What about you, Brianna?
I don't know if I ever really considered being a nurse. I think I was just a natural born caretaker.
Yeah.
I had a grandfather that was really sick, but I didn't realize he was sick when I was a little girl. I just liked to take care of him.
Yeah.
Anything he needed, I would take his medicines, I would rub his feet and make him comfortable.
Yeah.
And I even have a paper from the 5th grade saying that I wanted to be a nurse.
That is so funny.
So I think it just was born in me, maybe.
I think it has to be a calling because the stuff that y'all, deal with and see, and then especially, I mean, it seems like forever ago. I mean, we're only 6 years out of COVID. And how was that time for y'all?
Challenging.
Yeah.
A totally different world.
Yes.
I mean, obviously it was something we'd never experienced before, but also at the same time, it was a true blessing to be able to be with people during a very scary time for all of us in a vulnerable state, and to give them some kind of comfort that someone was there with them, medically to help them figure out their medications and things, and to help them still to get well. So.
And when we think of nurses, we think of the ones that are in the hospital, ones helping us to have babies and all the things. What's different about caring for patients when they're then in their homes?
Probably the personalization.
Yeah.
You just have a familiarity that you don't really get in the hospital system. During COVID, kind of going off of that, the majority of my career was spent in the hospital. So during that time, I was still in acute inpatient care working with COVID patients. So just the difference there, when you're in the home, you get to spend more time. You're not rushing around between multiple different patients. You're able to be with them week to week, get to know them, get to know their families. So it's very personalized in that way.
Is there a moment that sticks out for y'all that you're like, I was really proud of this part, or is there's something that you can think of? I mean, obviously dealing with all the COVID stuff, you're gonna remember that for forever.
I feel like just like I said, just to be able to be there with people. People are terrified to go to the hospital at times. So to be able to be there and connect with their providers and still give them the care that they needed within their home was just a tremendous blessing for all of us. So,
are we still needing nurses? I remember sometimes it was like we were on a big nursing shortage.
Absolutely.
Yes.
I feel like there's just so many different places where nurses are needed. So it's not just the hospital, it's not just in the home. There's so many different jobs, careers, different avenues that nurses take, and they're needed every place. In the majority of my career, it's always felt like there's been a nursing shortage, that we need more people, more caretakers.
Because it's hard being y'all. It came naturally to y'all, but it's just a tough job. There can be some crazy hours. You're away, it's you're super appreciated. You really are. So what if people are thinking about, maybe I do want to do that? Any advice for them, or what road should they go down?
Become a nurse.
Yeah.
I've worked with a lot of younger girls, whether they're CNAs, they're coming into the medical field, whatever avenue they're wanting to take, and they can get a little bogged down in school, and I'm like, just keep going, because it is so rewarding.
It is so worth
At the end of the day, I feel like half of my identity is being a nurse, and it's been very fulfilling for me. So
I feel like it's one of those jobs too, especially when people are like, oh gosh, college is so expensive now. But I feel like once you become a nurse, it's one of those that you're kind of set. You can work here. If you got moved to someplace, then
there's so many
you always
options.
will have a job. It's one of
Yes.
the, it's, you're working for
Security.
something. Yes, that's exactly it. So many options. Well, we love our friends at Interim. We hope you feel special on your,
Thank you.
on your day. And if you want to learn more about everything that they do, there's a website on your screen. And make sure if you see a nurse today, give them an extra little hug. Let them know that you appreciate them. interimcares.com is the website for you. Well, thank you, ladies. We appreciate it.
Thank you so much.
Now